Why is the UNOS system used for COPD lung transplants? Imagine waiting for a lung transplant and knowing that the system deciding who gets the organ is fair and transparent. That's what the United Network for Organ Sharing, or UNOS, makes happen. It manages the entire process of matching donor lungs with patients across the United States. This system is designed to be fair, ethical, and efficient. It makes sure that lungs go to the patients who need them most, based on medical facts, not income or fame. The UNOS system uses strict guidelines to decide who gets a lung first. It looks at things like blood type compatibility, the size of the donor lung compared to the patient's chest, how close the donor is to the recipient, and how severe the lung disease is. For patients with chronic obstructive pulmonary disease, or COPD, this is especially important because their lungs are badly damaged and they need a transplant quickly. The system also considers the overall health of the patient and how likely the transplant is to succeed. COPD often gets worse over time, and when medication or other treatments no longer help, a lung transplant might be the only way to improve survival and quality of life. The UNOS system keeps a central database where patients are listed after careful evaluation. Each patient gets a score called the Lung Allocation Score. This score shows how urgent their need is and how much they could benefit from a transplant. The higher the score, the sooner they are likely to get a lung. This system also helps transplant centers coordinate care smoothly. It connects organizations that recover organs with the hospitals that perform transplants and the patients waiting for organs. Because lungs are in high demand and availability can change quickly, the UNOS system makes sure that organs are shared fairly and promptly. It increases the chances that a patient with COPD will receive a suitable lung in time. UNOS also has strict rules and constantly checks to make sure that the quality of care remains high. After a transplant, patients need ongoing care, and the system supports this by ensuring access to specialists who handle everything from surgery to long-term follow-up. This helps improve survival rates and keeps patients healthier longer. In short, the UNOS system is used for COPD lung transplants because it makes the process fair, transparent, and based on medical need. It helps match the right lungs with the right patients, giving more people with severe COPD a chance at a better life.